Thanks so much, John, and you give me way too much credit, but thank you anyway. I'm going to share my slides and hope that you can see them. So the conference committee asked me to share a bit of an update about the work that Pain BC is doing. So assuming among the audience today, there are old friends and colleagues, but also many people who do not know our organization. So I want to provide a bit of background and then talk about the new directions and some things that we've been working on over the last year. So our organization's vision is a future where no one is alone with pain. And as John said, we're really focused on enhancing the well-being of all people through a number of different strategies. Just a little bit more about where we came from. So Pain BC was started by a group of healthcare providers and a few people who lived with pain. The idea at the beginning was really a bit vague, to be frank. You know, they recognized that the system was broken for people who live with chronic pain. And initially they said, you know, we think we could solve this by creating a bunch of new tertiary pain programs. Once we really got into the issue, we saw that so much more needed to be done. We needed to co-build everything we did with people who lived with pain. We needed to have a co-leadership model. So not just building and then running off, but really continuing to have people who live with pain engaged in everything we do. We needed to approach it with a collective impact model. So Pain BC being the kind of backbone organization that would work with a very, very broad group of actors across multiple systems to drive forward a significant transformation, not just a transformation in policy or practice, but really a cultural transformation in how pain is understood and treated. We realized that we needed to expand beyond thinking about government funding, becoming a registered charity with diverse funding sources, and weaning ourselves from our early start where we were funded primarily by the pharmaceutical industry and faced challenges with that around our own integrity. So very quickly we weaned ourselves from that and starting in 2017, accept no funding from the pharmaceutical, cannabis, or medical device industries. We've become, over the last 11 years, while BC-based, an organization with both national and international reach. So a bit about what we do. There are 6 core interconnected strategies that drive everything that we're about. Of course, we want to prevent pain, we want to intervene early, and we want to reduce its impacts. Fundamental is empowering people who live with pain. We want to educate healthcare providers on both assessment and management of pain. We want to improve multiple systems, not just healthcare, but many other systems where people who live with pain interact, where people who live with pain are affected. We're talking prisons, we're talking the legal system, we're talking auto insurance. There's so many systems that really affect the lives of people who live with pain. So we're working on many of those fronts. Of course, combating stigma is so important and working on issues of structural and systemic inequity. We want to foster research on pain and pain-related disability. So we do these things through a number of different specific actions, and I'll tell you a little bit more about those as we go. So on prevention and early intervention, we've been supporting hospital and community-based initiatives. So Rob was speaking about the transitional pain services that they're developing in Alberta, and we've been working in BC to develop some both hospital and very frontline community-based services to try and prevent acute pain from becoming chronic, not just after surgery, but even just after injuries through a partnership with a fracture clinic. We've been working with BC Children's Hospital, knowing that pediatric pain just has a potential to create a lifelong trajectory for children whose pain is not treated well. So we've been working with our Provincial Children's Hospital on their 𝐒𝐂𝐑𝐈𝐁𝐄 certification and a number of other initiatives, and then advising our provincial auto insurer as we move to no fault insurance in BC and create a whole new model of care for people that are injured in motor vehicle accidents. This slide is somewhat deceiving because it implies a linear progression through this continuum of self-management supports that we've created. In truth, we know that not one size fits all, and we've created a number of different programs. They are informed by people who live with pain. They are very much delivered in many cases by people who live with pain. And the idea is that people can come in and out of these programs as it fits their life and their need. I'm going to tell you a little bit more about some of them. So Live Plan B is our patient portal. It's a website that has a multimedia repository of self-management and other pain-related information. There people can take assessments. They can be directed towards the kinds of information and tools appropriate given those assessments. So it's something that requires people to be motivated, know how to navigate that. So that's one option for people, but it's very much self-guided. We also have My Care Path, which is a similar tool geared for adolescents and young adults. We have a provincial pain support line. This line is really a one-stop shop. People can call it on an episodic basis, one time. We also have people who call the line repeatedly and access support, both through a listening ear, but also help navigating systems, filling out forms, all of those kinds of things. We are shifting this model. It had been a volunteer-driven service, and we now, primarily due to COVID, where we've seen incredible increase in the degree of distress and disability that people who live with pain are facing, we are now moving this to a social worker staffed phone line. We have our Making Sense of Pain program. This is an 8-week low barrier self-management program geared towards people who experience marginalization, homelessness, addiction, mental health issues. We have 2 versions. One of them is an Indigenous specific version that is co-led by an Indigenous elder. And we've run this in multiple sites. In the downtown east side of Vancouver, in Indigenous communities, in primary care clinics, and we're further expanding that and tailoring it to work in the addictions and harm reduction space. Our Gentle Movement at Home program is a program that was created really in response to COVID. We saw very quickly after the sort of lockdown early in the spring that people who live with pain were experiencing very high rates of disability and just not being able to access the supports that people typically rely on. So not being able to go to the pool, going to physio, going to acupuncture massage, even just going to the community center and having a gentle movement or relaxation type program. So these are stills from a series that we ran in response to COVID, where we had some of our advanced practice physiotherapists and occupational therapists leading gentle movement and relaxation sessions. And as you can see, we had just tremendous uptake of this program. COVID hit, we launched this 2 weeks later and just had tremendous results. So all of these are archived on our YouTube station, our YouTube channel, and they're being utilized all over the Western world. We're getting incredible feedback from clinicians using them with their patients. We have pain support and wellness groups that we launched at the end of 2019. These are peer-led groups. The peers go through about 50 hours of training plus ongoing debriefing with our clinical staff. And they host groups with a set curriculum that has a sharing and a movement component. Again, we've seen tremendous uptake. We moved these online after COVID hit. We've started with 8 groups. We've just expanded to 12, and we expect to continue to expand that over the course of this year. We run a lay coaching program staffed by 56 volunteer coaches, most of whom live with pain themselves. And again, seeing tremendous uptake of this program. We are trying to reduce barriers to access to this program. It is something that requires a healthcare provider's referral. And what we saw with COVID, of course, was people weren't accessing healthcare providers, and access to this program was significantly inhibited. So we're shifting that and hoping that we can get many more people the assistance they need through this coaching. It provides up to 12 weeks of free coaching for people who live with pain. And we see tremendous therapeutic benefit to the coaches themselves, both the giving back, but their own learning about pain and just seeing them apply the learnings in their own life. So really powerful stories coming from this program. The third strategy that we are working on, of course, is educating healthcare providers. And we have a laddered model to do this with a number of different programs. So the first is our Pain Foundations program. This is a 5-module, 10-hour program. It's currently provided free to any registered healthcare provider in BC. We are planning to make it available outside of BC on a cost recovery basis later this fall. And this really establishes foundational knowledge. We opened the doors to say, you know, if we launch this program, is there interest? And within 3 weeks, with very little promotion, we had over 1,500 people sign up for a wait list from 15 countries around the world. So similarly to this conference, I think just huge demand for learning about pain. We then have our second tier, which is discipline-specific training, one for general practitioners and allied health programs for OTs. We have run them for physiotherapists, registered massage therapists, and chiropractors, as well as some programs that are currently dormant for mental health care providers and pharmacists. The last step on this laddered approach is our ECHO for chronic pain. So this is a video telementoring program with an interdisciplinary hub team that provides both didactic teaching and case-based learning for spokes around the province. Again, just incredible demand for this program. Just in our April to June session, we had nearly 1,000 healthcare providers register and participate. And this is a very well-researched program that demonstrates incredible outcomes. So we're very happy to be providing it in our province. Once we get people in the door, we don't want to let go of them. So we've really worked to develop a community of practice through a number of different approaches. So I'm jealous after listening to Tracy and Rob about the work that they've been able to continue doing this year. We met last year and BC was on the road to a provincial strategy. COVID has really upended that work and we've been very much in a holding pattern. But we continue to work with our provincial and regional health authorities on moving that forward. We're doing things in other systems. So we're working with a nascent group of legal advocates and lawyers to advance pain-related human rights issues. We're working, as I said, with our auto insurers, working with the federal government through the task force, and increasingly looking at the employment sector as an area where people who live with pain need support and advocacy. We want to combat stigma. When I was referencing, trying to create a cultural change, it's not enough to change policy. We know that people who live with pain face tremendous stigma, both the suck it up, it's in your head, I'd love to not work too, all these kind of destructive messages that people who live with pain hear over and over again. So we've worked very hard to become Canada's leading voice. We do a lot of work with cultivating media, and we've seen the fruits of those labors, not just ours, but through our network across the country, an 80% average year over year, 80% increase in coverage in the media. We've won numerous awards for our work with media. We train people who live with pain to be media spokespeople, and we've really become the backbone organization for many groups across Canada for National Pain Awareness Week. Research. We know that so much more needs to be known about pain. We also know that there's so much that we do know that needs to be translated into practice and to really make it useful and accessible to people who live with pain. So we've been working on a number of fronts there, creating a provincial pain research network, helping researchers recruit, and helping to mobilize knowledge. I think a key part of our work, as John mentioned, has been advocating for people who live with pain to have their rightful role in co-building and leading research. Expanding our directions. I apologize for the background noise. That's when you know your child has come home from school. I appreciate the humanization that Zoom has brought to our lives, where we get to learn more about each other in this way. So we're further customizing our programs. As I mentioned, our Making Sense of Pain program. We're currently working to integrate that into some overdose prevention sites in rural British Columbia, training harm reduction peers to become pain educators. We're scaling our programs outside of BC, nationally and internationally, and then continuing on with our provincial and national advocacy. So lots of areas for development, and so much of it in coalition with many of the people on this panel and many other organizations. So please reach out and connect with us. Thank you so much for your attention. Really great to be here with this wonderful panel. Thank you.